Good morning to you all. Today being the 3rd of March 2025 on this beautiful spring morning. If we can go straight to the agenda, item 1, apologies.
Good morning, Chairman. I've received apologies from Councillor Val Chapman, with Councillor Hallam Adams attending as a substitute.
And welcome, Councillor Adams. Number 2, declarations of interest. Councillor Edgeley.
Thank you very much, Chairman, and good morning, everyone. Yes, Partner Governor to Midland Partnership Foundation Trust. Thank you.
Thank you. Councillor Peters.
Thank you, Chair. Local Authority appointed Governor at UHDB.
Okay. Looking round, I think that may be it, but I always say that if anything comes up and it suddenly comes to mind, please do indicate interest that it may have. So going on to item 3 of the agenda, the minutes of the meeting held on the 27th of January 2025. Do I sign those as a true and accurate record of that meeting? I'm getting no dissent, so we're happy to do that. Thank you very much. I'll do that straight away. So moving on then to the main part of our business. Item 4 is an update on the mental health support teams in schools. And to present the report, we've got Nicola Bromwich and also beside her Becky Murphy. If you could present your presentation, we'd be very grateful. Thank you.
Thank you. So the report basically updates members on the sort of status of mental health support teams in schools and outlines their sort of key role and function and the progress across implementation. But additionally, it kind of references the other support that's available for schools, such as the school-based emotional wellbeing services and all of those initiatives sort of aimed at student wellbeing, which is why my colleague Becky's here along with me today. So members might remember that the mental health support team approach was very much set out in a number of key documents, including the Green Paper, and referenced in a number of sort of strategies around the NHS. And it's predominantly in recognition of this growing prevalence of poor mental health and poor emotional well-being amongst children and young people, which continues to be in place. So it's really important that we continue to do this. And, you know, the statistics still remain that 1 in 5 children and young people have a probable mental health issue in 2023. So essentially, the Green Paper really focused on how we wanted to improve mental health in education. So it's very much around incentivising schools and colleges to train senior mental health leads, and then obviously the delivery of these mental health support teams in education settings to provide that very much that early intervention as soon as we can with children and young people. And members might remember that across Staffordshire and Stoke-on-Trent, we were one of the first trailblazer sites in 1819, which meant we had 2 mental health support teams across Newcastle under Lyme and Staffordshire Moorlands. So we were very fortunate to be one of those early waves. And since then, we've been increasing and expanding the provision of mental health support teams across the area. So each sort of wave that we've had an opportunity to do that. So there's a slight correction to the report here. We actually have 10 mental health support teams that are focused across Staffordshire itself. And we have, I'm pretty pleased to say, we have full district and borough coverage in terms of having at least 1 team in every district and borough of Staffordshire, which is really positive. So the mental health support teams have kind of core functions very much around delivering that evidence-based intervention for children and young people, supporting those senior mental health leads in those education settings, so very much around that whole school college approach to good emotional mental health, and really sort of giving timely advice and liaising with those external services to make sure that we're getting the right support for children and young people and ensuring that they stay in education, which is obviously a core aim. So in terms of the sort of current provision that we have, obviously our mental health support teams are delivered via our 2 mental health NHS trust providers, so MPFT and North Staff's Combined Healthcare. So I'll just update you on the sort of latest position in relation to that. So for MPFT, following Wave 9 and Wave 10, that, as I said, completed our expansion into all districts. So I think the last district that was remaining was the South Staffs District Council area, which we've obviously now provided coverage for there. So currently, our MHST offer in that sort of south-facing patch covers about 114 schools and provides about 45% coverage. So we've still got quite a way off our sort of 100% ambition. So there's lots of detail in there about how MPFT have been implementing their approach, but very much focusing, as I say, on that whole school approach, really getting those strong working relationships between what they call their CASBAR, which is their single point of access, and core CAMS, really sort of enhancing the curriculum through the implementation of those one-to-one sessions within schools. Really trying to diversify the resources as well. So again, focusing on people, on those children and young people that have SEND needs, to making sure that we're really meeting their needs as well. Lots of sort of community events have been taking place, particularly trying to engage with those children, young people and families that I think the NHS traditionally struggles to engage with, and trying to remove those barriers. And lots of sort of innovative things around sort of podcasts and things like that, really sort of trying to interest children and young people. In terms of North Staff's Combined Healthcare, again, a slightly higher percentage of coverage there. So in terms of 60% coverage across the schools in Newcastle under Lyme and the Moorlands. As I said, we really did benefit from being one of those trailblazer sites in that patch. Again, they're delivering a whole range of interventions that you would expect around low intensity cognitive behavioural therapy, and lots of whole school approach activities. So lots of things that you'd expect around classroom workshop, breakfast clubs, peer mentor training, attendance at parents' evenings, things like that, just trying to really integrate the offer into core provision. Again, a real focus around SEND as well, making sure that we're making all of those links. And Combined Healthcare are just about to host an event actually on March 18th that's really aimed at empowering the whole educational community around the sort of 8 whole school principles across mental health and wellbeing in schools. And if counsellors in that sort of particular area are interested to attend that event, please let me know and we'll make sure you get an invite. So, there still are lots of challenges to the delivery of the mental health support teams in schools. It's quite a mandated programme around the education mental health practitioners that have to go on very specific courses to get trained and then become qualified. And we've had a number of problems in sort of retaining those posts and recruiting those. So it's a constant sort of programme of training to really boost our numbers of education mental health practitioners. There still are a number of barriers to whole school support, and that really becomes more of a challenge when the mental health lead within the school isn't part of that that school leadership team, so might be sitting within a different role outside of that school leadership team, so not necessarily getting some of the traction that we might want. An additional challenge is that participation in mental health support teams isn't mandatory for schools, and you might think schools should be sort of biting a hand off in terms of wanting to engage in this, but unfortunately a number are not. So it's about trying to trying to work with them, and unfortunately we are sort of considering withdrawing from some schools because of the lack of engagement, and then because we need to make sure we're targeting our resource and getting the best impact out from that. So we might need to divert that resource elsewhere to another school in that area, which is unfortunate, but we are doing all we can to try and re-engage those schools to make sure that that doesn't happen. But there's some of the challenges. As I mentioned, you know, members might be aware in the new sort of NHSE 25-26 operational planning guidance, we're really pleased that there's an ambition to achieve 100% coverage of mental health support teams by 2029-30. So I'm sure members in this room, along with ourselves, have always been quite uncomfortable that we haven't had that coverage, that, you know, that some schools get the resource and other schools don't. So we're really pleased that that ambition has been announced by government, and obviously it will take us a few years to get there, but as I said, we've got a really strong basis across Staffordshire on which to build. And a lot of that will be around enhancing, you know, the curriculum for mental health support teams. So again, a bigger focus around things like neurodiversity, for example, and, you know, trauma-informed approaches as well, because that's a lot of the things that we're seeing with our children and young people. And really focus on where, you know, areas might be underserved, both in terms of geographical coverage, but also demographic. So again, thinking about, you know, how do we reach out to those you know, schools and education settings who perhaps are not as willing to engage with us, and really trying to break down some of those barriers as to how we can start to make a difference to those children and young people. So in summary, the sort of mental health support component of CAMS has really offered an opportunity around early intervention. The engagement programme, sort of led by the whole school approach, has really made a positive impact. There are no clear indicators at this time that mental health support teams reduce the referral rates to core CAMS, but as I said, it's you know, it's only been a few years still, and it's a programme that we'll need to start to realise. As I said, the expansion is really welcome, and we are expecting for Staffordshire and Stoke-on-Trent in 25-26 that we will be able to mobilise an additional mental health support team that is likely to be focused in the south of the patch, but obviously we need to take account of those new parameters that the operating guidance has given us in terms of where we need to target in terms of those groups of individuals. So that's a brief overview for you, Chair.
Thank you very much for your presentation and the report. I think probably my opening remarks, it's disappointing to hear about engaging in schools where some aren't engaging with you. I think that is to probably make clear it's them not engaging with you, which is a great disappointment, but it's that proverbial you can lead a horse to water but you can't make it drink. I'm sure that you'll try and work something out to overcome those engagement issues. Yeah,
Thank you. So I'm sort of here from the commissioning team in the local authority, and just to kind of reassure you on that, we are using every tool at our disposal with those schools who aren't engaging, in terms of utilising Tim Moss as our Assistant Director for Education to kind of give those schools a little bit of a nudge. We also have colleagues in districts that work really closely with schools, so I don't know if you'll have come across our effective practice development officers who are on the ground in districts, and again, where we find that a school is not engaging, we get our EPDOs to go into the school to have a conversation to try and understand the challenges and barriers. So we're working really closely with our ICB colleagues and with colleagues on the ground to get into those schools to really explain to them what the benefits are of them engaging with that.
Thank you for that, Becky. I think that's quite helpful. I've got two councillors indicating to speak, and suddenly all the hands go up, so I will try and get round to you. I will get round to you as quickly as I can. But if we could start with Councillor Charlotte Atkins.
Thank you, Chair. I mean, it's not really surprising that you're not seeing the reduction in CAMS referrals, because what you're dealing with is really level 1 and level 2 mental health distress, rather than the more critical end, level 3 and level 4, where CAMS would be engaged, if you want. And it seems that if you are dealing with level 1 and level 2, then obviously that whole school approach is absolutely vital. But the feedback I'm getting is that actually there isn't that much of a whole school approach happening in most schools, at least not in North Staffordshire. And is that because you haven't got your mental health lead embedded in the senior leadership team? Is that the problem?
So, in relation to the reduction in referrals to CAMS, so the premise of the mental health support teams is that by meeting that need earlier in level 1 and level 2, that actually children wouldn't progress to the level 3 and level 4, so that would demonstrate the reduction. But just to explain the context of that, but I think, as I've sort of mentioned, the increasing prevalence of poor mental health in children and young people for all sorts of reasons has meant we haven't observed that. I think in response to your question, Councillor, I suspect it's a mixture of reasons, but I certainly think not having the mental health lead within the school as part of that senior leadership team is definitely one of the big contributing factors to that whole school approach not being embedded across, certainly.
And is there any trend among what sort of type of schools are not engaging? Or is it, I mean, do you think that the reason they're not engaging is because they don't want to admit that they have mental health problems within their schools? Is that the issue? I mean, it's rather like in terms of, you know, you have a school that's very good for SEND, and you've got others who are repelling SEND pupils for all their worth, because they don't want to be known as a school that's good for SEND, because they don't want that to impact on their results. Are we seeing the same thing with mental health?
I wouldn't say there's a trend in that we can identify a really clear pattern. I would also reassure you that it is the minority of schools. The majority of schools who are offered MHSTs absolutely bite our hand off and absolutely want to engage with that. I think there's a mixture of reasons why, and I don't know all of them, but some of them are, some schools are reluctant to believe that this is a free service, that actually they feel like if we sign up for it in a couple of years down the line, are we going to have to pay for it? So I think there's some myth busting that we need to do with schools, and those staff that I referred to earlier, the EPDOs and other colleagues, are having that conversation. I think some schools are reluctant because we know school staff are incredibly busy. They've got lots of demands on their time, and there's almost a little worry about if we agree to this, what resource demand will be on us. So again, I think some of the work we do with them is saying, well, actually, this is work you should be doing anyway. What we're providing you with is the additional resource. I think one of the key things that we as a local authority are really conscious of is the mental health leads in schools often have multiple roles. So sometimes you'll get a mental health lead who is also the designated safeguarding lead, who may also have multiple hats. So what we've really tried to focus on as a local authority working with partners is how do we put the support in for the mental health lead in the school to help support them. So we have got a mental health leads in education network that we've set up that brings those leads together, both virtually and in person, to kind of support them deliver that, because some of it is about I think schools potentially being unwilling to put their hand up because they don't want to commit to something that they can't see through, and it's about giving them the encouragement, the support and the resource to enable them to take up the offer. So, yeah, sorry, that was a little bit of a rambling answer, but in answer to your question, I don't think there is a clear trend. I think there's multiple reasons, and we're taking different steps to address those different reasons for non-engagement.
Another issue, of course, is the mental health of staff themselves. Because if they're overburdened, and this comes from somebody who works very close in the mental health field within schools, saying that many staff are very stressed and therefore they find it very difficult to take on additional roles. And of course, you're not retaining staff, particularly in the EMHP groupings, presumably because they see this as sort of an entry-level job, and then they move on to other jobs potentially within the mental health field.
Yes, so one of the values of the mental health support teams programme is the practitioners have quite reduced caseloads, and that's really in reflection of the population that they need to serve. But in relation to the EMHPs, because we have been, we have to comply with what was Health Education England's training programme, a number of the universities that we could access in the Midlands sit way outside of the Midlands even. So they tend to attract people who are not necessarily from our area. So that's why we've struggled to retain. But also you're correct that a number of practitioners do see this as a stepping stone to other careers and other professions, and that's why we're starting to look more flexibly at wellbeing practitioners and things like that that could fulfil the same roles but don't necessarily have that training, but we could give them an additional top up to that training, if you like, that would then convert them to an EMHP, and then we could retain them through that workforce. So we're trying to look at as flexibly as we possibly can to make sure that we have the workforce in place to deliver that care.
Lastly, have you tried to engage parents in trying to encourage schools to engage more?
Yes, so I think that does need to be part of our approach, and I don't know whether necessarily we've done that to the full effect yet, but I know the community, kind of the whole school approach does include, you mentioned staff wellbeing, but it's also about community wellbeing as well. So yeah, we have got a group of people who are being led by the MHSTs who are looking specifically at that engagement with schools, and one of the things that they will be looking at is not only engagement with staff in schools but engagement with families and communities as well. So we will be seeking to explore that.
Okay. I'm just going to go through my list, because obviously I saw lots of hands go up and I wanted to be sure that I've captured. So I do apologise if I haven't called your name out, but please obviously say so. But I didn't quite get everybody, I don't think. So I've got Councillor Anne Edgler, Councillor Janice Sylvester Hall, Councillor Jill Hood, Councillor Steve Norman, Councillor Bernard Peters, Councillor Phil Hewitt. Was there anybody else who indicated to speak? So therefore I might have got it all then. Thank you very much. Phil Hewitt. Yes, yes. Second on. So I may... Oh, before I do that, I just wanted... I should have said it before the meeting, but welcome to Anna from Health Watch. Anna is replacing Baz, who has been promoted within Support Staffordshire. So welcome, Anna. I should have, very remiss of me not mention it beforehand. Thank you. So, Councillor Anne Edgler.
Thank you very much, and good morning, and thank you for your report. I found it very interesting. It's lovely to hear you say about early intervention, because I've been shouting about that for about, I don't know how many years. But my understanding is, about these schools that's not taking part, and I'm wondering, as councillors in our area, is there anything at all that we can do? Because I do know from experience, if these children don't get the help at that early stage, what impact it can have on their lives later. So I'd like to think, we can help you, going into schools and talking to the headmaster or whoever, and see if we can do anything. Can I then put my Midland Partnership Foundation Trust hat on as the partner governor from the county and say to you, is there anything or message that I can speak to Midland Partnership to help, moving forward, to help them process their work within the mental health with children, so I'd like to think that I can help in that way as well. And my third question is about quiet rooms in schools. These schools that are taking part, do they have a quiet room in the school where if a child comes into school absolutely distraught or for whatever reason, they can take that child and talk to them in a quiet environment and that? And I would hope that there's somebody in the school that would be able to help those children with the problems they've got. Sorry, I'm losing my voice. And and the other thing is about the buses that you've got. How are you circling them in Staffordshire? You've got these mental health buses that's going round, So are they impacting on every area or, so that I'll shut up now, Chairman, thank you. Apart from I'd like to come back about children in care, but I'll leave that for somebody else to pick up.
Over to Becky?
Yeah, I was just going to pick up the first element. So thank you very much for that offer, Councillor, to engage with those schools that we perhaps are having a lack of engagement in. We're certainly happy to link in with you on that, and perhaps we'll explore that as an option where, you know, some of our other conversations haven't worked. I guess for me, the message that we'd really like to get out is, as Nikki said during her presentation, we don't have 100% coverage of MHSTs, and I think one of the messages that I want to be really clear about today is we're not saying that if you haven't got an MHST, you haven't got anything. So you will, I know, Councillor, we've emailed recently, you will be aware that we do have an emotional health and wellbeing service that we do commission in partnership with the ICB that actually works with mild to moderate mental health needs as well. Where schools don't have an MHST, they can get support from that service, and they will also support them with the whole school approach, with one-to-one support and with professional development in schools as well. So I guess from my point of view, elected members, when you are having conversations with schools in areas, if schools are talking about mental health and emotional health and wellbeing needs, it's the message that whether or not you've got an MHST, there is support available to you, and I'm more than happy to act as that point of contact in terms of checking, does a school have an MHST or not, and what's the route for their support. But again, thank you for the offer of engagement. We'll definitely be coming back to you on that, so thank you.
And just to continue from Becky's point, I think, again, from an MPFT perspective, I think all and any support is very welcome in sort of our aspiration to improve children's emotional well-being and mental health. I think in terms of the school space settings, I think that varies from school to school is the honest answer. So alongside this, the ICB has been leading a programme around partnership in neurodiversity in schools. And that's very much been around how do we support that process around what are the reasonable adjustments that can be made within all school settings to ensure that children and young people can engage in a different way. But I think that sort of safe space, if you like, in school settings is really variable, but we are sort of working towards that. In terms of the bus, the bus that sort of MPFT have is predominantly around talking therapies, which is our talking therapies adult service, but there's a really great point there in terms of how could we use that in a different way to support children and young people. So I'm quite happy to sort of take that back to MPFT and have the conversation, and equally I'm sure you're in your role will be able to do that as well, so thank you for that.
Thank you, Councillor Edgeler. So next is Councillor Janice Sylvester-Hall.
Thank you very much, Chair. I'm going to take some of my questions out of turn because I think that that's a really good one to carry on with, if that's okay, from Councillor Edgeler. One of the first things that I did upon getting elected as a county councillor was to get a list of all of the secondaries and primaries within my division and introduce myself to say I'm here for you as a school within the community, as well as the residents, obviously. And I think that would be also a good opportunity for us to, and schools, my background is in education, I would say, to do that famous word that I'm allowed to use once a week, which is called triangulation. So when we have residents that are approaching us as councillors, that we know some of these issues, that we can also look at being part of the solution to support within the school as well. And I think that would be a really helpful mechanism to say, okay, we've got 45% that are signed up at the moment. Correct me if I get any of the stats wrong. Some of those aren't actually actively engaging. So I think there's a good opportunity there to be able to do that. But equally, you need to make sure that you've got the staffing also in place. And I appreciate what you've said about the staffing turnover. I'd be interested to hear more about what is being done with the staffing turnover. And from what you've said, a lot of the training providers are located elsewhere. But I also believe that we've got quite some good local universities, especially having been part of the teacher training process as well, that also do health provisions at those campuses too. So I'd be keen to hear what you're doing on the staffing turnover, because if we did increase the amount of schools that were engaged, have we got enough staff to be able to support them, would be my ultimate question with those. And Councillor Edgeler has mentioned also about children in care. We both sit on the same corporate parenting panel, and that's one of the aspects that we we'll have many lengthy conversations with about supporting children in care within their school settings. So a few questions for myself, if I just recap on those ones about engagement and are we equipped to do so, what are we doing on the training and to making sure that the staff that are there do stay, and then equally what specific attention are we giving to those children in care. I think that will keep me for now, but I may well come back later, Chair. Thank you.
So in terms of the universities, so what we do encourage is our local universities to apply to become one of the curriculums that could deliver that. To date, they haven't at this stage, but that is something that we continue to pursue. Obviously, the conversion of a lot of the course to online has helped, again, in terms of getting that local recruitment. I think just in terms of the makeup of a mental health support team, so there's a sort of standard makeup for that. So it's not purely reliant on just the education mental health practitioners. So we would expect 4 of those posts to be within each mental health support team, but there's another sort of 3.5 that are sort of core posts that we can recruit to outside of that sort of training programme. So it's a blended mixture. As I said, what we have been trying to do in terms of recognising that we have this, I suppose, training lag, if for want of a better word, in terms of education mental health practitioners, is to look to where we have children's wellbeing practitioners that are qualified and sort of giving them that top-up training to convert them into an education mental health practitioner. But it is a kind of constant sort of programme around workforce retention and support. In terms of the sort of some of the protected characteristics like looked after children, for example, I think that's one of the areas where we've recognised we need to do more in terms of mental health support teams in schools. And certainly the new driver that's come out in the operating guidance is very much how we look at those children who are sometimes the most vulnerable and the most excluded, and oftentimes that is our children and young people who are in care, who may also have other additional needs around SEND or autism or other needs. So I think we really recognise there's a lot more we need to do in terms of that cohort of children and people and how we support them differently. So it's not an answer that I can respond to here and now. It's just recognise that that's a programme of work, not just within our mental health support teams. It's a programme of work across our entire children's mental health services that we need to do much better for that cohort of children and young people.
Can I just add just a little bit in addition to that around the looked after children specifically? So Nikki's referenced the work that we're doing across the partnership. So we do have, as an ICS, an integrated care system, we do have a Children and Young People's Mental Health System Improvement Board. One of the work streams that sits underneath that is the Care Experience Children and Young People, which is the full breadth, so children on the cusp of coming into care, children who are in care, and also care leavers. We've done a piece of work sort of within the last 12 months or so, where we did some work and analysis to try and understand what the gaps and barriers are being faced by that particular cohort of children. I won't rehearse all of the answers now, but they won't be a surprise to you. What we've then been doing as a system is looking at those findings and trying to understand what can we do to the different elements, whether it's MHSTs, whether it's our emotional health and wellbeing service, whether it's our core CAM services, what we can do differently to meet those needs more effectively. So one example of that would be we've just recently recommissioned our emotional health and wellbeing service that I referenced earlier. We've actually very clearly built into the service specification our expectations around care experienced children, but also vulnerable children more broadly, so around what can they expect, what's the enhancement to service that we might be able to offer, and we're doing that to all elements. So it's actually one of our main priorities as a board, is that cohort of children and children with other vulnerabilities as well.
Call Councillor Jill Hood.
Thank you, Chairman. Charlotte pretty much covered what I was going to talk about. It's very disappointing to know that it's not mandatory in schools to have a mental health practitioner. really disappointing, and I know that parents that I meet in my division who've got a child who's undergoing a struggle with mental health services. Sorry. And they always say to me, you know, I say, well, have you been referred to the relevant? And no matter which relevant service I talk about, the reply is always, there's a massive waiting list. We just have to give up. You know, we can't continue. We've got promises of being seen and then nothing materialises. Because so much has been said now, which I wanted to cover, I will just very lightly touch on, I would imagine, not even imagine, would know that parents would be appalled if they knew that the school that their child was at was not engaging with your practitioners. I find that just so difficult to fathom. But I am a cabinet member on the district council, and obviously housing is a real problem for our children, some who live in appalling conditions, you know, and asylum seekers, and you obviously see all of these young people. But to know that 1 in 5 of our children will at one point suffer with a mental health condition, and to know that, you know, we're not doing enough about the housing that the children have available to them, children living in bed and breakfasts, hotels, you know, this has a direct impact on our children. And our care leavers, I'm always so proud to say, we in Staffordshire look after our care leavers until they're 25 years old. So that gap, when do they stop becoming a child and when do they become an adult? I know that, you know that. But, you know, how long do we have the resources to actually look after these children with these mental health problems? And of course, you know, it spills over into their adult life, then it's a cycle, isn't it, where their children are going to suffer with probably the same mental health condition. I could talk to you all day. You'll be very relieved I'm not allowed to. But, you know, there's so much we've got to do, so much.
So thank you for that. And certainly I think the parent angle is certainly one I think we need to explore that perhaps we haven't put as much effort into as perhaps we could have done, so definitely. But just to resonate with what you're saying, you know, it's all the wider determinants, isn't it, around mental well-being that contribute. So things like housing, you know, things like whether your parents or caregivers are employed, you know, whether you have access to friendships and social, all of these things really impact, don't they? And can impact through childhood into adulthood. So there's an absolute understanding of that. And yes, again, you know, people don't magically turn an adult, do they, on their 18th birthday? They're still the same person they were at 17 and a half. So it is about how do we do things differently within our provision as well, and certainly within mental health services, we're very much looking at that, you know, sort of preparing for adulthood from sort of 14 years old, and really trying to understand what we need to do differently, particularly for that sort of 14 to 25-year-old age group where, you know, adult services are not necessarily the best placed response for them, but we do need to do something different. But those are all sort of evolving sort of pieces of work that we're looking at. But I absolutely, you know, hear all your concerns. So thank you for that.
Could I also just make a quick comment just about that wider network around children, so including families, parents, foster carers, school staff, anybody and everybody. The piece of work I referenced earlier where we tried to understand what the gaps and barriers were faced by care experienced children specifically, but also all children, was around the real importance of upskilling the network around children. And when I say upskilling, I don't mean making the parent into the mental health practitioner, but I mean giving them the skills and empowering them to have some of those conversations. Because actually sometimes it's not about referring a child into a specialist service, it's about, does the classroom assistant have the skills and confidence to do what they need to do to support the child? So we're doing a piece of work at the moment, we're just about to embark on it to map out what is the support that we're currently offering to the network around the child. So for example, I know there's lots and lots of training available to foster carers, but that training may not, or that resource may not be available to other families and parents. So what we're trying to do at the moment, under the auspices of the board that I referenced, is map out what is the support that's available at the moment, and then reviewing that to see where the gaps are. So where do we need to plug the gaps? For example, do parents know where they can go to get support to help them support their children? So that's a piece of work that's very live and relevant at the moment. But we're aware it's a gap and we're working to fill it.
Okay, thank you. Can I call Councillor Steve Norman?
Thank you, Chair. Thank you for also stopping me spending 10 minutes, quarter an hour looking for Anna as a councillor in Staffordshire. I would have failed, obviously. Find a councillor with 2 bottles of water would be unusual, I think, to be quite honest. Obviously, the obvious question was about what was the reason for schools that aren't taking advantage of the service, but that's been answered, except to say that I think the key there is to embarrass the schools by making sure the parents are aware of it, and apparently that it's free, if that was a possible thing. But those theories why they might not be taking advantage of this service has been spoken about, and I think that seems fair. But we're just going to keep on trying. But it'd be great to have a list of schools that are doing it. I can then work out that those that aren't, so it's not picking on those that aren't doing it. But if there's a list somewhere of those that are doing it, I can work that out. And then, as councillors, Joan Sylvester Hall has mentioned about making sure she was known to all the schools in her patch, then we can do that. My question is just got one question really, I suppose, on the basic one, which is on 6, which refers to the England were identified as having a probable mental health disorder. So it's a bit vague, that probable mental health disorder. And it refers to the numbers here, 1 in 5 children in this age group. On radio the other day I was here that 1 in 7 of us, I include myself here, is neurodiverse. And so my question is, and just tell me, read this document somewhere and I'll look at that and I'll do that. As the definition of mental health changed, I mean, there's 2 reasons why it might be. One is that we're just getting it wrong. We're having a wider and wider definition, or it might be that we know more now, as we do with knowledge increases, and therefore you can define it that way. But then you've got a label, and once you've got a label, you know, the individual has a label on them, they themselves start acting towards that. I mean, you know what I'm trying to say? It's complicated, but, and as I say, if there's a document, a policy, some great paper that I could read and understand, please point me in that direction. But if you've got any views on that, and I'd like to come back on one little thing, if I may, Chair.
Yeah, I mean, we certainly welcome that offer of providing the sort of list of schools, and we'll pick that up. In terms of it is odd language, probable mental health disorder, and essentially it's based on, there's this kind of national survey that goes out that's called the Psychiatric Morbidity Survey, and we base, well, not I myself, individual, the national team base statistics on that, but largely it's around a prevalence-based model, which is why you hear that word probable. But I can certainly send you the links to the reports to go into it in more detail. Absolutely.
I need to do my job, which is my job to read up the background. So I'm not asking you to do that for me. Thank you. Just to mention that I'm chair of governors of a school that was emotional behavioural difficulties. I forget the latest term now. They keep changing. But they have more. We do find that the children that we're getting, that the county wants us to take, have more complex needs. There's no question about it. But we have a quiet room. We can give the children if they want to kick off, they can kick off in the corridor in case you ever see the front door banging, or be in the quiet room, or there's pet therapy, Lego therapy, all these sort of things that we have to do because these children have got so many complex needs, and it's quite tragic to see how they're affected by them. So. Yeah, thank you. Just much that.
But I think it's a really important point you raised there about not wanting to give children a label or a diagnosis. You know, children are children, and I think that's where one of the skills around the mental health support teams and that whole school approach is about how do we support all children in a different way. You know, where children do need that help, we absolutely need to get them that help and find that within CAMS. But it's absolutely important that we, you know, make those differences early on for children as much as we can. So we just recognise that actually they are children and we just need to learn to support them in a different way. And very often it's us that needs to change how we respond to children and not the other way around, and I think it's getting some of that in place. So thank you for that comment.
Councillor Kath Perry, did you want to declare an interest, I hear?
Yes, please, Chairman. I'd like to declare an interest. I won't take part in the debate. Okay, thank you.
Councillor Bernard Peters.
Thank you, Chair. I've just echoed the sentiments of everyone about the lack of engagement across certain areas in the county. That really is a challenge for you and a massive disappointment for me, and I suspect colleagues as well. But could I just pick up on the point you mentioned regarding the engagement south of the county, which has not yet taken place? I don't know what plans you have to initiate that work. But if there's a delay, the delays that you're encountering now, and it takes some time to resolve them, does that mean that the timescale to get into the south of the county, and I'm thinking of East Staffordshire and Burton-on-Trent, where I'm from, that will be extended even further? So is there a hesitation and a nervousness, should we have one, around the current timelines for these pieces of work? And I'm always sparked with this sort of debate by Sir Michael Marmont's 8 principles that he set down in 2010 and revised in 2020 about every child should have a good start. And what's prompting me to make that comment is the statement in the foreword of the document, which talks about ethnic minorities being somewhat underrepresented or not being dealt with yet. So something about when are you going to get the pathway into Staffordshire sorted out, South Staffordshire sorted out, and what exactly are your plans to address inequalities?
So really pleased to say that across East Staffordshire we have 2 mental health support teams in schools, and there is very, very good engagement across East Staffordshire in terms of the uptake of that. In terms of the expansion, which I think is what you're referring to, is that correct, Councillor? So the additional team. So there are 2 cohorts that we could be part of. We're not clear yet because we're awaiting some of the national guidance, but that is likely to either be September 2025 or January 2026. So what that does is give us a whole project planning period to build up to. So what we normally do is we work in partnership with our local authority colleagues to identify again the areas of need, look at where those schools are that we might need to engage with, and certainly those aspects around demographics will be part of that decision making in terms of where we roll that additional team out. So where we are experiencing greater inequalities, for example, from a health perspective, that will be part of that decision making criteria as to where we roll that team out. But we're just still awaiting the final position from the national team in terms of which wave we will fall into in that. But we'll have at least a good 6 months planning process to be able to build and start to do that. And I think one of the points that I'm kind of learning today is, once we've had that sort of decision-making process, is how we really use the skills of the councillors in this room to start to lead some of that for us in terms of the school engagement and start to do some of that early on, which we haven't done before, I have to be honest. So I think that's one of the learning points we can start to implement.
Can I just also say, just as a reassurance for councillors, it is the minority of schools who don't engage. So the majority of schools, when they're offered MHST support, they do absolutely snap it up. Where there are schools who don't engage, often when we go back in and do that additional work about that conversation with somebody they know in their area, then they do take. So we aren't talking about the vast majority of schools who are not engaging. It's the minority of schools, and I think there is a real opportunity, as Nikki said, to actually involve you in those conversations from a councillor to school perspective that would be really helpful. But most schools take up the offer when it's offered to them.
You happy with the response, Councillor Peters?
I think so, Chair. I'm just anxious, of course, just because I come from East Staffordshire, perhaps, that the process to address inequalities we don't want anyone left behind. That's the base. I know that won't happen. You'll endeavour to make sure that doesn't happen. But where English isn't their first language, there can always be a challenge. So I wish you all the very best on that, and let's hope we can see some significant progress.
Okay, thank you very much. I've still got 4 speakers to go, so Councillor Phil Hewitt.
Thank you, Mr. Chairman. I did have a long list, and everybody would be delighted to know that most people have asked the questions as they've gone along. So, a couple of simple questions. First one, a really simple, straightforward one. Do you work with a virtual school? I couldn't find anything on the report that said you did or you didn't.
So yes, the virtual school is engaged in the partnership, so we work very closely with Sarah Rivers.
Okay, thank you. And the second one, there's a slightly more complexity to this question. It's always disappointing when you see this level of investment, but then not see the result that you're specifically looking for, which I think would be the reduction in CAMS referrals. I know that's not singular in its sense, but at the same time, it's something that you would be pleased to see. So, has there any work been done on a sort of really tighter level, or, to look at what referrals to CAMS have gone through, and then to see whether your team have done any work with them to see whether you've had any effect? So rather than looking in the whole and say, these are the amount of children we work for, I've been looking through the data trying to look for this, but I couldn't find it. So these are the children we work for, these are the success we've had, etc., etc. But the CAMS referrals have pretty well stayed the same. So have we gone down to a micro level, is that the word I'm after, or a macro level, one of the two? To look at it and think, well, these are referrals, but we did or we didn't work with these children. Am I making my question clear, Mr. Chair? Very specific.
Yes, we have. I don't think we have done that detailed piece of work around, referrals directly into CAMS. I think, as councillors might be aware, this was very much a sort of mental health support teams was very much a pilot, a sort of proof of concept. And I think what it is found is actually, whilst the original intention was to reduce CAMS referrals, is actually there was a more significant level of unmet need that was sitting in schools in level 1 and level 2. And so that's perhaps why it hasn't translated. But we submit lots and lots of data to what's called the mental health minimum data set that kind of looks at all of that. And so there is sort of national evaluations going on that we haven't had access to the input from that. But that is certainly one of the areas we could look into for you. I just don't have that information to hand.
That's great, Mr. Chairman. It would be good if we could look at that. I think some of the answers may be there at that level. But thank you, Mr. Chair.
Thank you very much there. Councillor Phil Atkins.
Thank you, Chairman. Apologies for being slightly late. I think there's been an accident on the A50 involving a child and an air ambulance, and the traffic goes all the way back to Stoke. So, sorry I'm late. I had to go through the back lanes. So I missed the presentation, but I've sat listening very carefully. And this reminds me of our very first health scrutiny back in 2003, when we did healthy schools. And we got told off for entering schools without the education department's permission back then. And we came across all sorts of things. During that, we visited about 13 or 14 schools. Room 21 was being just set up at Leek High School. And since then, the YES has been set up at Thomas Lane's, the Youth Emotional Support Scheme. And we found that it was very varied across the whole of the county. Since then, academies have come along. And I can remember coming here and we'd have a healthy schools meeting, and there were hundreds of schools involved in Staffordshire in it. It wasn't just about mental health. It was about a whole host of PSHE matters on relationships, anger management, healthy eating, diets, as well as mental health. And I fear that we've ended up going down rabbit holes listening and going into a box-ticking exercise of where we can do, when we've forgotten what we're actually about is helping schools.
one of my mottos when I was the leader was Borough with pride. And I'd well advise you to go and have a look at North Yorkshire or Leeds, where they have these programmes up and running. Because what we found in that scrutiny was schools love awards. They love to be a gold healthy schools standard, and they had to hit certain things to achieve that, and to show that they were involved. And there were 7 programmes or modules from memory where they had to do it to get the bronze, silver and gold, and you got to egg them along a little bit. So times moved on. School budgets are tight. They had to pay to go into these things. Not a lot of money, actually. It was just to register. You know, it's a bit like my Red Tractor Award chairman. Cost me about £300 a year, but I get nothing out of it except an inspection. You know, I have to pay for the inspection. But at least you'll know that anything with the Red Tractor on it has got decent food. And that is what it's about. It's not about looking for things that that you want. Yes, has become a bit of a fundraising monster, sucking in money to keep the staff employed on the emotional support side, which supports all the schools in the Uttoxeter area. But rather than the whole school approach is the better way, where all the parents, the teachers, the school environment are involved to help children, because it's not just about picking them out and putting them in this box outside the school community. It's supporting them to remain within the school community and help them with their friends. Because when they have a problem, they end up with all sorts of other things like anger management and shyness or non-attendance at school, and you drill down and you find out why that child is absent on that one day. I've never forgotten some of the things we found out. They were horrific. You know, they didn't turn up because the parents couldn't afford the equipment that they'd been asked to bring in on that particular day. So the whole school approach and healthy schools is the one that I'd recommend, rather than us asking for you to turn up with more stats and figures which prove that you're doing one little bit well, but not the whole school approach properly. And that is where NHS, County Council, schools and Academy Trusts must work together. That's our job. Thanks, Chairman.
Thank you, Councillor Atkins. Some inciting comments there. I don't think there was any direct question for our colleagues, but I think...
it was a word of advice.
Yeah, we'll take the advice. So, on that, we will move on to Councillor Julia Jessel.
Chairman, a lot of very good questions being asked. A lot of work's gone on, and I'm very conscious of my title is Vice Chairman Overview, and I've been sitting here thinking I don't want to duplicate really good questions and answers that have already gone on. But the thing that does worry me is when statistics like 1 in 5 children at some stage in their other will experience mental health problems. And I think you have to step back and say, is that because we're, as Councillor Norman said, and I have to say, we have a bit of a joke, we get worried when we tend to agree with each other. I've known Steve for a long, long time. That actually, are we labelling children as having mental health problems when actually all they're experiencing is the ups and downs of life? Because life, every so often, as we all know, and the older you are, you realise can really be, I won't say it in public, but very difficult at times. And I'm very conscious that it's not healthy to label children who are just going through a rough period. The other thing is that resources are always finite, regardless of politics or anything else. Resources are finite, whether it's finance or whether it's the people to carry out the roles. And I think Janice raised some very good points, and you've mentioned about recruitment and retention. And so if you're not careful, you end up spreading your resources so thinly that actually you don't achieve anything, or you don't achieve as anywhere near what you would like to do. And my fear is that the long waiting lists, which Councillor Jill Hood have mentioned, get longer and longer because actually you've increased the cohort of people that you're trying to support to the point where actually it just doesn't work anymore. And I think that's always the bit of the problem of the NHS. You're always trying to resolve the problem. You're always firefighting because the demand's always increasing. You're spreading your resources. You're trying to work, and as has been said, you know, with schools, with the county council, and if we're not careful, those who really need that rapid access to support as soon as possible, we're failing them because, you know, the waiting lists are months and months, and sometimes it's over 12 months. So I've put down here the root cause. In terms of overview, I think as a society, not just the public sector, not healthcare, not education, not the county council, but as society, we're actually missing the point. Why are children struggling like this? And I've got a great niece who she tried to commit suicide 3 times, so I've got family experience of trying to help. And her problems as a 15-year-old were down to social media and being absolutely harangued and slagged off on social media. I think we do have to, as a country, as a society, tackle this problem of young people becoming addicted to social media and the evil that is spread worldwide within split seconds. And I think we need to get to a point where it's not only schools saying no mobile phones, no access to that kind of social media during schools, but as a society, you go out for a meal, there's families there and they're all glued to their phones. They're not communicating. We've got young people who find it so difficult to talk to their own families, let alone communicate with their other school colleagues. It's a society problem and we're not tackling the root cause. I read an article last week that across certainly the I won't say the Western world because it's the same now in Japan, Taiwan, there is a disease of epidemic proportions of young people, of children with short-sightedness. And they say it's A, because of the excessive screen time, and B, apparently, being out in the sunshine and the fresh air as a young person helps your eyeballs to develop properly. And it's becoming epidemic proportions that we have young people now who, because of lack of exercise, lack of fresh air, are suffering physical problems. And I believe it's the mental side as well. So I think in terms of overview, you're trying to do what you're doing, which is, in a way, helping to pick up some of the pieces. But I would say that as a society, and it's picking up on Philip's comments, you need to look at the bigger picture. And I think we've got to accept the fact that our young people are exposed to things that actually their parents have got the power to switch off. Because I really fear that actually it is an epidemic, and I don't like to see young children labelled as having a mental health problem because they carry that with them for the rest of their lives. And I do think we need to start saying to schools, to parents, get your children outside, talk to them, and I know I'm old and ancient and about to retire, but there are some of the lifestyles that were apparent in the 50s and 60s that actually stood people in good stead for adult life. The knocks, the bruised knees. We've tended to wrap our children up in cotton wool and they're becoming more and more fragile, but now they're being bombarded by social media, which for so many of them puts them under huge pressure, body image, etc., etc. So I think you're doing a wonderful job. There's been brilliant questions asked, but I think we need to step back and say we're firefighting. We need to tackle the root cause and the healthy living, that we're trying to promote both the NHS and the County Council. So, you know, it's a bit of a plea for the future. Can we look at the bigger picture and try and start to tackle and support schools and parents and children, tackle the root cause? Because actually, we've all got the power to deal with it. Thank you.
Really interesting points, and I'm just sort of reflecting on what you're saying, and you know, we can deliver a whole school approach and support children and young people, but if they're going back into families or care settings that are not equally supporting that approach, then it's not making the impact, isn't it? So I absolutely understand where you're coming from. You know, in terms of the mental health support teams, that is an expansion, so it is a growth, so it is additional workforce, and they have very tight parameters on which to work on. So, you know, we can't serve more than 8,000 pupils per sort of team. But I absolutely, you know, understand what you're saying. There's that sort of old phrase, isn't there? It takes a, you know, a village to raise this child, and it's how we all come together in a different way. And it's the answers aren't within the NHS or aren't within the County Council. It's about how collectively we do things together. So yeah, your point's absolutely resonant.
I'd also just add to that I think the mental health support teams and our emotional health and wellbeing service are genuinely incorporating or taking forward the whole school approach, which isn't about mental illness per se, it's about emotional health and well-being. So I think the conversations that we're encouraging schools to have is how do you create an environment that is emotionally healthy, and it's not about pathologising children or labelling them with mental health conditions. It's, as you said, some of these things are just a normal part of growing up, being anxious, being a little bit shy, being worried about your exams, etc. It's about how do we create environments which give children the skills, the tools, the resilience to actually respond to the bumps that come with a normal kind of growing up in the UK as it is today. And I think a lot of the work that I think MHSTs and our emotional health and wellbeing service are doing is around creating those sorts of environments. I think the work I mentioned earlier about the support to the network around the children is also about that. So actually, if your child is anxious, if your child is worried, it's not about saying they've got a mental health condition, it's about saying what can we put in place to support you to develop resilience to be able to manage those emotional challenges that we all face.
Thank you. Some very thought-provoking comments there, and I think it's an overall I don't disagree with. And it'll be very interesting regarding to social media, exactly how the recent news of Australia governing that they will are banning mobile phones within schools. And I think we ought to be looking at that, and hopefully if there's some very interesting results come from that activity, because I think it would probably go a long way to help. So finally, I've got Councillor John Jones on this particular item.
Thank you, Chair. I have to say my list of questions have gradually been eroded over the last 3/4 of an hour, and I thought I'd still got one left, but I was over there, took that one away from me. But I'll just add on to that. I do get concerned a little bit about labels and labelling kids too soon. Anecdotally, I bumped into an ex-schoolmate of mine last year, I think, an ex-primary schoolmate of mine, and he's now the successful MD of an electrical company. But there's a line in a film from Thora Hird, and she said, "There were no ADHD in my day. When you were naughty, you sat at the back and did raffia." And I think this lad was always at the back doing raffia. And there were no mental health support back then. And I just wonder how successful he would have been had he been labelled as having mental health issues when he was 6 or 7. So I think it's a caution that we have to be aware of, that we don't label them too soon, because I think sometimes, you know, if they get that label, I've got ADHD, so I can be naughty. I've got ADHD. It's a medical thing. So that's the only point I just wanted to make. And the other thing is about schools that aren't engaging. I mean, maybe they haven't got any problems. Maybe some of them haven't got any issues at all, or maybe they're just dealing with them because it's the run of the mill. It's the rough and tumble of school. I mean, I sometimes wonder about the quantities, the percentages of kids that are labelled now with having mental health issues, when some of it might just be
the trials of life, if you like. That's just one point I want to make. That's all, Chair. Thank you very much.
Thank you, Councillor Jones. Again, I'm pretty sure there wasn't necessarily a question in there. Councillor Atkins, I've got somebody else that did indicate to speak
I was
before,
just
but
listening
if you
about. I was just listening to the comment about some schools don't think they have a problem. The scrutiny that we did 20 years ago found that the schools that thought they hadn't got a problem had, because the pupils were going to the school next door to get help.
Thanks.
For me, Chair, that means they did know they'd got a problem, does it not?
Okay.
No, the children did, but the school didn't.
Let's move on. And I'm very, Councillor Helen Adams indicated to speak, so welcome.
Thank you very much. I have an issue with this labelling or not labelling, really, and I know what you mean. But if a child is diagnosed with as neurodivergent when they're young, it does go some way to explaining how they feel, because the brain works quite differently than those of us who aren't. So, and it shouldn't be an excuse. And if there's education around that, and the parents are educated and so on, and the schools, then that does go some way to explaining, and they can use it not as an excuse, but to understand why they are how they are. So that's all I've got to say, really. Thank you.
Well said.
Thank you, Councillor Adams, for that balanced approach. Nikki, would you like to come on that one?
Yeah, it's just to support that in the sense that label or not label, the most important thing is we get the right care and response to the child regardless. And for some people, you know, it absolutely is important, and for others it's not, and it's really taking that individualised approach. But the most important thing is, you know, we respond to the need and we put in what the care that's required or those adjustments that are required to meet that need.
Thank you for that, Nikki. I think that's a good response there. But I think we lots of good comments, good questions have been made today, and we've spent well over an hour on this. And I have to say, as committees go, great contribution from members. And obviously apologies to those that were down on the list, because all of the questions have been good. And obviously what it's good to hear is that a lot of those questions and comments we're all thinking alike. And I think what that does demonstrate for me is that there is concern in this area, and in a sense you're bringing from your own divisions and so forth, wards, etc., your experiences in life that can bring to the table to help with the responses. I will let you.
Looking at the stats on page 24, MHST access, there's everything apart from South Staffordshire. Is that a reason, or do we come under Stafford and surrounds?
So where's that? Sorry.
On page 24.
Where was that?
Sorry, the team in South Staff's district has only just completed its training, so they won't be reflected in this cut of statistics. They will be in the next one, so that's why they're missing. Sorry.
Okay, thank you for that. So I think we've given this really good work. I think what's important that we still see this as an item going forward. I think it's important. It would be remiss of a health and care committee at the county, whichever way things develop for the future. But I think it's important that we've got. So our recommendations for today was that we've noted the plans, the plan which provides an update on the current position of mental health support teams in schools, and B, notes the outcomes achieved, the challenges and the barriers experienced, and future development and expansion. I think, members, would you agree that we've given that a good, thorough check? Obviously, in terms of bringing it back, I think that's something for the work programme that would go forward. But Nikki and Becky, may I thank you very much for a very comprehensive report and more importantly, very good, concise answers to some of those questions. I think we've got to say thank you, and I think that demonstrates really the understanding and the depth that you are currently working in, and I think that's got to be appreciated and commended. So thank you very much for your presence today. Thank you. So thank you. We'll bring that item to a close, and you're quite welcome to stay for the rest of the meeting, but we will move on to item 5, which is the delivery of Staffordshire's Good Mental Health Strategy 2023 to 2028. And coming to the table is the Cabinet Member for Health and Care, Councillor Jeremy Pert, and we've got Jan Cartman. Becky stays with us. Is she? No? Yeah, Becky's here if she needs to be. And we've got Chris Stanley there back. Known Chris for quite a few years now. And so welcome. So, Councillor Pert, would you like to introduce this item to members?
Thank you, Chair. Good morning, Chair, Vice Chairs and Councillors. I would like just to start off by associating with the comments of the Vice Chair earlier about the environment that we live in, because I think it's a really important point that, you know, we create the environment and sometimes we look at how we adapt to the environment rather than saying, actually, is this the right environment? And funny enough, I was having a very similar conversation but on vapes earlier, because, you know, we've created that environment and it'll be something that we live with going forwards, and I welcome those comments. I don't want to go on to talk about vapes, in fairness. I'll stick to the subject. So we're here this morning to look at not the mental health, good mental health strategy, because that was agreed a couple of years ago, but to look at the progress that we've made with the strategy. And I hope members will agree that the inclusion of the action plan at the end really demonstrates a focus from both the ICB partners as well as the County Council. We're all aware of the need to achieve parity of esteem between physical and mental health. We've seen through the funding of NHS England that they play an important part to ensuring access to, a good access to mental health services. And you can see through a number of different strategies the desire to promote early intervention through the shift to the left, through prevention, through community services. In part we talk about some of those today, but the other thing I should say is that this is a joint strategy with the ICB. And the reason that's important is, you know, we often talk about co-producing, we often talk about joint strategies, and I think here you've got a joint strategy that is working and working well. And you can see from the range of colleagues that we have with us today that you know, it is a partnership approach, and I think that's a really important place to go to. On that point, I'd just like to hand over to Jan, who's going to introduce the report in more detail.
Thank you, Councillor Pert. Thank you, Chair. Yes, just to introduce, so there's a number of people who've worked together regularly to deliver on this strategy action plan. Obviously, Nicola Bromwich is here to represent the ICB that the strategy and action plan is joint with. And then Becky Murphy has always also stayed with us, who's the link for children and families. And Chris Stanley, who's both the suicide prevention lead in health and care, but Chris is also the public health lead for the strategy and action plan. And they are here today in case there's any particular questions in that area. So just to introduce the report, what I thought would be helpful just to reiterate, I think when the strategy was agreed in the action plan, obviously it's a very large and complex area of work, mental health and mental well-being, and there's a lot of programmes of activity across Staffordshire that were already happening when we did the strategy and continue to come on board. So the Good Mental Health Action Plan, we've identified a range of activities to support the objectives of the strategy for us to focus on and track, to kind of enable us to track delivery and outcomes, and it isn't intended to be exhaustive. So there will be other programmes of work and activities still occurring in Staffordshire that we won't necessarily have reported on today. The other thing to note is that although the strategy wasn't all age, when we engage with people, young people, particularly around their move to adulthood, was an area of concern. So we have worked closely with ICB activities and with colleagues and children and families, particularly around that period of transition and opportunities to improve young people's mental health ahead of them becoming adults. So the strategy and the action plan covers the key areas around prevention and well-being, access to services and response to crises, equity, people with long-term mental illness who need long-term care and support, and also that area particularly around transition to adulthood, which is a challenging time for people and as they move between services. So as I said, Public Health, Children and Families and ICB and myself from Adult Social Care, Care Commissioning work together to deliver on the action plan. In the report itself, I mean, you've seen the action plan is quite a big document. So in the report, we've identified some examples under all the outcome areas to feedback on progress and share some sort of qualitative information around progress, but also where we've got data that we are tracking. Some of the data doesn't change significantly one year to another, so it would be more, it will tell us more over the 5 years, but we've included that where we have it. And then obviously at the end of the report, we've included the full action plan, should people have any questions on that. And then obviously any questions.
Bill Hudd.
Thank you. I hate to say this, but I found the everyone can look after their own mental well-being and find support in their communities when they need it. Can they? I find a lot of people who can't. And that disappointed me. I think those who are at their lowest ebb and alone do not know where to go to find that help. And I know we as councillors, in particular those of us who are very much hands-on, we as councillors do play quite a large part in this, but I would absolutely argue that this is not so. There are many very capable people out there who may suddenly feel, for whatever reason, I need help and I know where to go and get it. But equally, there are just as many people, including children, who have no idea why suddenly on a particular day they are feeling the way they are feeling and perhaps lash out aggressively or bizarre behaviour which is not normally noticed, which can also manifest itself within adults. So I'm really sorry, I have to take exception to that headline. Thank you.
Thank you. A response.
Thank you for the question. So I think that headline is where we want to get to. I think we wouldn't say we are there, absolutely. So I think some of the work that's been going on is aimed to improve that, and that will be a work in progress. And I think one of the things I reflect on, so when we did the original engagement for the strategy, and we had a fairly big response, about 630 people that did respond. And the thing that stood out for me was that when you asked people who you would go to talk about if you had concerns about your mental health or mental well-being, and pretty much, well, everybody said either friends and family or professionals, GP, social worker. And then one of the gaps we want to try and address is Staffordshire has got quite a wealth of voluntary sector and sort of supportive communities, which is some of the work that we have been doing. There is some, I think it's very in small detail in the action plan. So what we have looked at, part of what we're tracking is around, certainly from the County Council's offer, the Staffordshire Connects, which enables people to go and look for support. Now there is, when I was preparing the report, there is a really big increase around the searches around mental health. What we need to do more work on is that because more people feel they need support, or is it that some of the promotional work means that people are kind of enabled to go and have a look there? I think I was quite surprised by that. So I think we've agreed with partners we need to see if we can find out more about why that change might be, because that is quite a significant change. But I think because of the feedback in the strategy, I would say this is an area I would acknowledge is something that we do need to work on. And I do know, Nicola, there's probably more work going on in the ICB that you might want to come back on that.
So just, I guess there's just some recognition, isn't there, that mental well-being, mental illness is on a spectrum, isn't it, in terms of need. So I think the outcome there is very much around more the sort of well-being and, you know, people being able to support their own mental health wherever possible, but always a recognition that there will absolutely be times in people's lives where they need others to step in and do that support. So particularly around, you know, talking therapies. I know the councillor previously in the session before referenced the bus and things like that. It's around getting that message out there around what is good mental health, how can people support their own mental well-being wherever possible. But there will always be, as you know, as you'll see from the detail in the strategy, services where we have to step in and provide that support. But definitely the aim is around how can we educate, inform, make things as accessible as they can be for people to take control over their own mental well-being. But again, that will vary from individual to individual. So what is right for me and how I can access things will be very different to you, will be very different to somebody else. And that's the skill of what we need to have in place across our whole provision of mental health services across Staffordshire, is have that range of options for people to be able to engage in at the right time and at the right place for those individuals.
In my division, Stone Urban, we've had 6 suicides over the last 5 years, all under the age of 40, all male bar one. And, you know, what you're doing is an amazing job, obviously, you're professionals. But I see Andy's Man's Club, you know, it is so advanced now and spread throughout the UK, and it does an amazing service. But I do wonder, you know, when's Nellie's Women's Club going to come popping up for the females? I'm being facetious there, but I couldn't think of another name. But it does worry me that there are a lot of people that can't ask for help. And it's obvious in my division in the suicide numbers of recent years. Thank you, Chairman.
Thanks, Councillor Hood. I think raising that and challenging that outcome, it was very appropriate. And hopefully the answers given at this stage, I would probably conclude this is work in progress, isn't it? But thank you very much for those responses. May I now call Councillor Steve Norman?
Thank you, Chair. I'm impressed with 12F. I wanted two questions. One is on outcome 3 and one on outcome 4. Outcome 3, 12F, where you explain the improvement that's been going. That's obviously very welcome and hope that continues. And I understand, of course, that intervention is part of the key to that and so on. But I tried suicide once when I was 21, failed. I can explain why I failed. But years and years afterwards thinking, well, why was I trying to kill myself? And I cannot tell you. I got no problems at all at that particular time. Yeah, when I was going to a lousy, rotten grammar school in Tamworth when I was a kid, I wanted to wake up every morning hoping that I hadn't been born. But that wasn't, I didn't try and kill myself then, but I did try when I was 21. And I've known other young men, very close neighbours and friends and others and that about that age have taken their own lives and been successful, you know, they've been successful. And I always think, well, if I'd seen them that day or spoken to them about anything, it might have moved them off that trajectory. But is there a situation where, let me tell you another story. Was that the chap who went to see his doctor because he was very depressed and so on? And the chap said, oh, this was in Switzerland. This was, come and see Grock the clown. He'll cheer you up. And he said, I am Grock. And that's it. Nobody would know from me that I was depressed or anything like that in those years because it's put on a different face. And so my question is, are you able to establish where people do commit suicide and they're successful? So, put it that way each time. And the reasons why that might be, what you can do for them. I mean, it just seems to be completely irrational. But I mean, I don't know why that. Well, you know what I'm trying to say, or endeavouring to try and say. I haven't a clue myself.
Chair, I'll just get Chris Stanley, the Suicide Prevention League. Come sit here.
Yes, thank you, Councillor Norman, Chair. It is a complicated question, and there are a multitude of reasons, and there are many, many triggers, and it's very much, as has been spoken before, there are external influences are huge on it. What we do have at the moment is a police-led real-time suspected suicide surveillance meeting where we are now regularly meeting, in fact every week, to actually understand what's going on in terms of the suicides we get on a weekly basis, and try and understand what's going on. So one we can certainly see if there were to be any surge in any particular locality or in any particular reason or trigger that we can identify. It's as good as the information that's gathered by the officers attending the scene. But what we're going to try and use that for more and more, because actually we're sort of pretty much one of the best in the country now with our real-time surveillance, is to try and use that to more effectively target just awareness, suicide prevention awareness training. Because as you and other things, because as you exactly pointed out, if somebody with many suicides, if somebody can actually just realise, actually intercept and intervene with somebody who's feeling that way, it can be deflected. And if it's deflected, it might not cure everything, but it might move past that point, and then it might never happen, as you explained. And that's probably one of the main things that we can try and do. So what we're trying to do is use that information now to be more effective in the targeting. But we're pretty early days with that, because the new real-time surveillance, because the other thing is things change. It's surprising how many things change, certainly from a locality point of view, how rapidly they change. And so actually you need that up-to-date data to be able to do that. I hope that answers your question a little bit.
That's very helpful. No, I appreciate that.
Okay. Thank you.
My other question was on 4, which refers in 19 there to the various the physical aspects of health. But I couldn't see in this document, I'm sure it's elsewhere, what the connection was. It's referred to there. It tells you what the monitoring is, which is always good. But it doesn't... well, I haven't spotted it, in case somebody spots it. I haven't spotted it in there, but I'm sure there's a reason. What happens when you find these things out, when there are other measures of cholesterol and blood pressure and all the rest of it? Well, what do you do with that information? Thank you.
Yeah, so councillors might be aware that for people with severe mental illness, there is a significant life expectancy difference in the general population, and it's approximately sort of 20 to 25 years that people with a severe mental illness will die younger than their counterpart population, and much of that is around preventable illnesses, and that morbidity gap actually isn't reducing across the country. So this is a real sort of priority area for us. So lots of these checks, and again they are for people with severe mental illness, are very much around sort of trying to do that, identifying things early and then putting in the appropriate interventions to obviously reduce that. So things like, identifying high blood pressure or diabetes or things like that that we know for some reason that doesn't happen within that population. So the measure is very much around the percentage of checks that we deliver, but you're absolutely right. The important bit is, well, once you've had the check, what are we then doing following that check? And that's where we start to do some of that broader pieces of work. And again, some of it links into our public health colleagues around smoking cessation, different things like that. So it really depends on what's been identified. But that's a work that's a real priority for us within the ICB, to reduce that gap where we can.
Thank you, Steve. Councillor Charlotte Atkins.
Thank you, Chair. What's the role of community projects within your strategy, by which I mean community projects which offer therapeutic activities and mutual support? I have seen in my patch the Nivden project closed down, which had operated for 20 years, offering horticulture, pottery, exercise, a whole range of things, and that just lies empty now. I've seen John Hall Gardens, which funding was taken away from. We think they've managed to cobble together funding to keep it going on a shoestring. I see a tiny charity called Borderland Voices operating, but they go from hand to mouth. They do a huge amount of work on creative writing, art projects, etc. But it's always a struggle for them to find premises, to be able to afford premises, and to have sufficient people who have lived experience of mental health supporting the project. So what I don't understand is that given we've got an explosion of mental health problems, why these community resources to keep people out of acute care, which is going to be far more expensive than keeping people in the community, why aren't they getting support? Now, I've looked through the document. I can't see any reference to community projects. And I just wondered what the role is. It just seems to be discounted. We can't leave everything to the voluntary sector. The voluntary sector may well run them, but they still need funding to do so. And it seems to be a huge gap in this particular strategy.
So from the strategy's perspective and what we do in terms of the ICB, and some of this was previously joint with the County Council, but we've done it in an integrated way moving forward, is we do commission quite a large number of voluntary community sector providers, but how we've done that is by using our trusts to act as that sort of procurement vehicle. And that's very much to make sure that we've got that aligned pathway. So, for example, around community mental health, so that we have that sort of aligned pathway for people. So organisations such as, Changes are funded, such as Burton District Mind, and lots of other groups are funded through those pathways directly through the ICB. What we can't do is fund everybody, obviously, but we do, we have ring-fenced significant amounts of funding to the voluntary and community sector to deliver that on our behalf. What we always sort of commit to do is to work in partnership around where we can do things more effectively, but there will be organisations that exist that we are not in a position to fund, and that is an honest account of the situation. But what we do try to do is to work with those in a partnership way to best effect for our population.
It's been proved in many parts of the country how cost-effective those sort of projects are, keeping people out of acute care, keeping them sort of topped up with support. And it just seems to be a false economy that basically the funds are taken away. They're left to, for instance, when Nivden closed, that they were referred to Borderland Voices? Well, it was a charity run by one person. You can't expect charities to take on, you know, a whole load of individuals without additional support. You know, it can't expand to fit the void without proper recognition and support. And I just find this incredible that we're talking a lot in the strategy about inpatient support and about therapeutic activities within the inpatient setup, but we're not talking about keeping people out of inpatient services. And it just seems to me ludicrous that this is what we're doing. You know, we have a vast problem out there, and you know, we're closing down those very organisations that, you know, in supportive communities can do so much to put people on the right road rather than the wrong road to acute mental health distress. And, you know, referring to what Councillor Hood said earlier, you know, I've unfortunately had quite a few people taking their own life, both younger and older people, over the last 5 years. And so clearly it is a significant problem, not just for younger people, but for older people too. And actually, if they had that therapeutic support, I'm pretty sure that those people would still be alive today.
So I absolutely take on board your points. I think what isn't detailed in here is the full range of services that are commissioned to do exactly that. So, for example, you know, we've commissioned housing tenancy support through the voluntary community sector. We've commissioned, you know, the CAB to do benefits advice, all of things that are aimed at supporting people within the community in a different way. So I think one of the things we probably need to do is to come back and sort of articulate that wider range of VCSE providers that are in place that aren't perhaps visible in this report. But I do take on board your points. What we are wanting to do is far more within the voluntary and community sector. I think it goes back to the point that I made in the previous session around recruitment and retention. It's about a number of these organisations are sometimes better placed to deliver effective care. But from a, you know, what I will say is we've increased investment in mental health support, but it perhaps isn't as visible in the report as perhaps we could have made it. So we'll commit to get the detail of the voluntary community sector providers that are commissioned, and you can see the greater breadth that we have in place.
Well, it needs to be more visible to the people that need that help. You know, you talk about funding the CAB. Well, as being a former trustee of Leak CAB, that's now gone because actually they struggled to find the funding. You know, and that is the whole point. You know, to spend hours and hours and hours bidding for support, you know, for financial support, means that they're taking that time away from the clients they're helping. CABs do a fantastic job. And a lot of people think that they're funded by government. They're not. They're funded by a whole range of different organisations, and they have to spend hours and hours finding where those pots of money are, just so they can keep going. Leak CAB doesn't exist anymore in the sense of a full service that we get. Obviously has some, you know, some support is offered. But, you know, these organisations do a brilliant job, but we rely on them too much. And we somehow think that they can be the safety net. No, the safety net has to be wider than that.
Thank you. Councillor Perk, you'd like to come in on this?
Yes, thanks. The VSE is a really complex sector, and I think you articulate really well the difficulty that they have in terms of funding, but also the role that they fulfill in terms of not just being there for a mental health purpose. It may be early intervention or something else. It's a whole range of things. So I think looking at the VCSE in just a very straight strata probably misses some of the other places that funding comes from. It's very clear that MPFT, as Midlands Partnership Foundation Trust, has moved their strategy towards in early intervention and funding the VCSE. I can't tell you what the level of funding going in this year is, but that's incremental funding. The County Council, whilst it's not looking specifically at mental health, has a supportive communities programme and funds a whole range of VCSE organisations, and I'm sure between the parties around this end of the table we could provide that list of who we're funding in terms of supportive communities, as well as the MPFT monies. And I'm also aware that, you know, districts and boroughs play a really vital role, and certainly in Stafford's case, you know, I know that they have just signed off the funding of citizens' advice in Stafford for the reasons that you very ably articulated. And obviously, county councillors also have funding which they also attribute to some of those groups as well. So I think it's a very complex picture, and to look at it just in a straight narrow way is probably unhelpful. But I do think there is really an objective that you somewhat infer, and I think it is an important objective, which is actually we probably, between all the funding bodies, need to look at a bit better coordination, because, you know, there is money that should be going to certain places that probably isn't, and there is probably some gaps, and a better coordination, and certainly that's a conversation I've had with the ICB, and it is an aspiration going forwards, because I think it will bring incrementality, if that's a word, to that complex picture that you describe.
Thank you, Councillor Pert. Next on my list, Councillor Edgeler.
Thank you very much, and thank you, John and Jeremy and Nicola, for your report. I pick up Jill's point and Chris's point about suicide. It's a cry for help, isn't it? You know, I mean, I've been in the situation, and I probably said it in the meeting before, where my son was going to jump off a roof. I got a message from the police and that, but actually somebody was there actually to talk him down from doing that. But that was a cry for help. But I'm really concerned about suicide and the number of people that are committing suicide. But I sometimes believe that if people want to commit suicide, they'll do it whatever we want, whatever help we give them, they'll do it eventually. You know, it's a really, really sad case. My question really relates to John, actually, and the question is, children that's moving into adulthood and children in care moving into adulthood, and living on their own with mental problems. Can you just talk me through the pathway that you give to them to help them in that situation? And just to make the comment, you talk about funding and that. I do believe that Stoke-on-Trent have just been given 16-point-something million loaned from the government to help with services. I think it's to do with children, so I don't know what they'll be spending that on, but that's just talking about the money situation. But really coming back to my question to ask Jan about the children in care and moving into adulthood. Thank you.
Thank you, Councillor Edgeler. I might call on Becky to talk more about the children's pathway. Some of the key things I think that are more recent developments that we've included in there that I think are positive are around the work children's are doing with adult services around the transition planning. So that's quite a new one. So the questions I've asked, particularly around children and young people where their primary needs is mental health and not necessarily a physical or learning disability, because obviously that often that's been present through their life, whereas mental health may be emerging. So some of the work they're now doing around more detailed transition plans and the social care passport, both those items that we've mentioned in the report are really around adult services workers working much more closely with the young person and children's practitioners to get to know them, understand what their needs are, what their aspirations are, what support they need, and that kind of goes with them for quite a long period of time, reflecting the sort of age range where people are have been care experience, so up to 25, and also the social care passport. So linking into the work Staffordshire have already done around health passports for people with additional needs, and again making sure young people with mental health problems as a primary need, that we're also identifying things like a social care passport, which helps them share information about, might be communication or support they need to help them access health services more effectively, particularly for me, because quite a lot of young people may have co-occurring needs. People don't just have one problem. They may have a mental health problem emerging, but they may also be neurodiverse. They may have a learning disability. They may have a physical disability, and making sure that they're sort of supported through that journey. The other work that's reflected where we do link in with children's is around the sort of work around sort of a good consistent standard around psychological assessments. So this, for me, makes sure that we're identifying the mental health needs of children much earlier on in that process. And also the work the Director of Children's is leaving around developing better provision for young people with complex needs. So the figure we're tracking around there are young people that have had more than sort of up to 3 placements in a year. So I think when we did the strategy, we talked with children's colleagues and with partners and looking at people's feedback. And one of the areas we were worried about are young people where their placements may break down because they may have unmet mental health needs. And trying to ensure that provision is that's identified and how we can work together. So I think some of the things we've included in there is particularly around that period of transition. And I don't know, Nicky, is there anything you want to come in on the ICB about the ICS? You've got a young person's mental health plan.
Yeah, so we specifically have what we call a local transformation plan around children and young people. And that does go up to the age of 25 in terms of, our children with special educational needs. So we, again, I think I sort of referenced in the previous session, that sort of 14 to 25-year-old age group is a real cohort that we need to really sort of evolve our service offer around. So we have sort of dedicated workers within both of our trusts whose role is to focus on just that age group and to really understand what it is we need. But we recognise there's much further we need to go in terms of that work, and we join our county council in the preparing for adulthood work. So we have that sort of integrated approach very much around how we do that.
Do you want me to come in just on care leavers very briefly? Yeah. So in terms of care leavers, there is a huge amount of work going on around that across the local authority and with partners. I'm not directly involved in that, and I don't want to do it a disservice. So I think if there is sort of further questions about that, we can bring that back to sort of talk about the pathway for care leavers that is being developed. Just from the point of view of the partnership that Nicky's just referred to, so the ICS, Children and Young People's Mental Health System Improvement Board, I referenced earlier that we'd done a piece of work to understand the gaps and barriers faced by care experienced children and young people, including care leavers. There were 2 main recommendations that fell out of that. The first one was to understand what are our existing services doing to meet the needs of care experienced children. So that was looking at our Emotional Health and Wellbeing Commission service, which worked with children with mild to moderate mental health needs and emotional wellbeing needs. And the second element of that is the CAMS provision that works with a higher level of need. For both of those services, we're looking at now what did the findings tell us and what can we adapt and change within those services to make them more inclusive and responsive to the needs of care experienced children. The second recommendation, which we're now moving on to look at, is to understand, is there something specific that care experienced and other vulnerable children may need that won't be picked up by those broader services. So that's a piece of work that's just about to start. We're pulling together a partnership group to look at that, to understand what's the data and evidence telling us that these groups of children need, and whether or not they're being picked up by existing service or whether they may need something additional. So that piece of work is just about to start.
And just before I come back, can you bring in Councillor Pert?
Thank you. Whole house today. Can I just pick up a couple of points? First of all, the councillor references Stoke-on-Trent. Clearly, we're not here to speak on behalf of Stoke-on-Trent City Council, but my understanding is that the £16 million loan is to generally support the MTFS medium-term financial strategy process and their budget generally rather than specifically one area. But the councillor may want to take that up with Stoke instead. The other point I just wanted to sort of pick up is that clearly as part of the CQC inspection, and a number of us have been involved with the assessment that happened early in February, but it was clearly identified within the self-assessment review pre-CQC. You know, there is greater work that we all need to do in terms of that transitioning from children's to adulthood. And there are several bits to it. One is the identification of people, and the appropriate people, and that clearly is an obvious one, but you know, sometimes the left hand doesn't know what the right hand's doing because people move into and out of geographical areas. And the second one is starting early enough so that we can influence what that long-term plan looks like, both for the individual as well as for those multidisciplinary teams that are there to support people. And there is more work that we need to be doing in this area, and it is a corporate priority for all of us going forwards because actually our young people are our future.
We'd like to come back on that, Councillor.
Thank you very much, and thank you very much for your answers. I just look forward to how we move forward and listening as we move forward as to actions taking place, because actions are louder than words, aren't they? Thank you.
Thank you. I've got three councillors wishing to speak still, so I'm going to call Councillor Janice Sylvester Hall, then Councillor Phil Atkins, and then Julia Jessel.
Thank you very much. I think for me, there's an awful lot of information in the report that I found really helpful to look at the progress on delivery. And there's a few questions that I've got about some of the content of those and the general ambition of what's been trying to be achieved, but I appreciate that this is about the focus on the delivery side. Something that we mentioned earlier on about the community funding as councillors, I've certainly found it absolutely enlightening to appreciate the local demands by use of my community fund as a county councillor, and by going out and meeting a number of the organisations locally that can be providing services to support. And I take Councillor Pert's comment about looking at the coordination of those. I think that's something that would be very useful, but equally, from my perspective, being able to understand local demand, I found it a really, really useful process. Starting early, most definitely. And if we look at some of the data in here, if I could just ask about how we use and how we utilise services outside of the county. So, for example, referrals that might be happening within Staffordshire County that go out into Wolverhampton to the GEM Centre, and how some of those are also documented within the figures that we've been given. I'm also aware of a case whereby referrals have been made. This particular one, for example, was on anxiety-based tics, and the response from the provider was, actually, we've got no staff trained to be able to deliver any support with that, so we're cancelling the referral. And again, if there's information that we've got on, is that an isolated incident? Is that something that also would be documented within the report? And equally, and I think fundamentally, and certainly listening to some other people's own experiences, when things go to crisis stage, do we know how to make those referrals at that point? You know, are we successfully getting the message across to say, if this is your need, this is where you need to go, and this is the port of call that you need to go to for that? And equally, I was keen, because I know we've had same conversations of a vein back in the chamber, with the involvement of the police, and knowing that their responses have also changed, and how we're making sure that when people do get to that crisis situation, that they're being signposted as effectively as they possibly can. So it is the starting early, take the point on that. Are we effectively being able to communicate the message to referrals for something like anxiety-based tics appropriately, and also to us individuals as well within the community? Thank you, Chair.
Okay, Nikki?
So just picking up on your first point around people who might go technically out of area of Staffordshire. So from a health perspective, they are included in our figures because it goes on GP registration. So very often, particularly on the south of our county, our borders, there's a lot of natural sort of patient flow outside of Staffordshire. You know, thinking in particular the sort of Seaston area in particular, you know, with Black Country, etc., which we support. So they are all recorded in our figures. In relation to, and I'll come on to the ticks one last, in relation to sort of crisis provision, what we have been building is a picture of how to sort of streamline access really in terms of crisis care. So you might be aware that during COVID, we rapidly established sort of 24/7 urgent access lines in both MPFT and combined healthcare. We have since sort of bolstered all of that in terms of the those lines are still in place, but we also have what's called NHS 111 option 2 now, which is the mental health option when you call 111. So we are encouraging, and that's a national sort of initiative. So the premise is that for exactly those reasons where lots of people don't know where to get help, that they can call 111. There'll be an option to, there'll be a mental health option, and then they will then get put through to our sort of urgent care crisis lines for a response. We're also currently just in the process of mobilising some additional resource around that, recognising that you know, lots of young people actually don't pick up the phone. So by, I think, end of March, April, we will also have a crisis 24/7 text line in place. So what we're trying to do is to make you know, sort of things as accessible as possible for people to get that sort of right support. Again, with our sort of talking therapies around anxiety and depression. Again, what we've done across Staffordshire and Stoke is put in a single number, a single contact point for people to self-refer to, and then they'll get put through to the most appropriate team to respond to their needs. So we are trying to implement lots of things to make it easier for people to get the help that they need at the right time, but we can always do more, and we have to keep constantly picking that up. Just in response to your point around the police, obviously we've had right care, right person, which I think is what you're referring to, that's being sort of rolled out in partnership with the police. So they have been changes to how the police respond, and we're currently sort of in phase 3, phase 4 of that at the moment. There are still some operational issues that we're looking at in terms of that response, and we've got a sort of planned workshop in a couple of weeks with the police, with all our health partners, to kind of discuss a number of those points, recognising that, you know, we want to make things for people as good as we can, but again, some of that is sort of work in progress that we're working towards. In relation to your ticks question, I probably want to take that one outside of the room, if that's okay, just because very often that's considered a neurological pathway, not a mental health pathway, and it can vary depending where the person is from and where then again their patient flow is, in terms of, you know, it could be like you say, you know, Derbyshire, it could be Black Country, etc. So that it's just a point of context that I'll, if Zach wouldn't mind just sort of dropping me a bit more detail on that, I can respond to you at another time if that's okay.
Yeah, I think the case in point with that is that it's an example of how we are signposting effectively. And if it's a case that we need to establish with the primary care network that this is the appropriate route, but if it doesn't work, then what happens? Because that potentially just would have dropped into an abyss otherwise if I hadn't have had some contact with it. And the same as if when people phone the police and say, this is happening, are we appropriately signposting? And it's looking at that collaboration and the co-production, and I think that's how absolutely we need to be responding on this particular one. And if I could just ask one sort of slightly more parochial question, on page 46 on 5.2 we've got Lichfield as being currently without an MHP. I just wondered if there was a time frame of when we might have one in Lichfield. Thank you, Chair.
Sorry, could you just repeat that on...
Page 4, I'm trying to find it.
Yeah, it was on page 46 in the action plan at 5.2. It's got Lichfield is currently without MHP, and I wondered if there was a time frame of when that there would be. That was a January 2025 update cell.
Yes, so these are the additional reimbursement roles which are shared with primary care. So they're part funded by ourselves at the ICB in terms of mental health. So that's a recruitment issue, I believe, but I don't have an update, so I'll need to come back to you on that one. So the funding's in place. It's a case of it's a vacant post, I believe.
Could I just respond for clarity around the referrals? So any of the figures and stats that relate to local authority rather than ICB, that will include Staffordshire people, even if they're, for example, if it's supported living, they might live out of area for a range of reasons, but we would still have included in the figures that we would be the responsible local authority and we'd be funding their care and support, so they would be included in the numbers.
Councillor Pert.
Just in addition to what's already been said, I don't want to repeat any of that. I just did want to also pick up something I should have mentioned earlier in regard to the voluntary sector. Because not only are we putting money into the voluntary sector, we're also putting money into the voluntary sector umbrella organisations, the likes of Support Staffordshire and equally Children's are putting money into skivvies as well. And that's really important because that helps build the base. You know, whilst I have an ambition to improve where that funding goes to, I think it's also, you know, really valuable that as members we all individually got that opportunity to go and see what's in our areas, because every year it seems to me to certainly be different and you find out new things and different things about how diverse our communities really are.
Thank you for that additional comment. Councillor Phil Atkins.
Yeah, thanks. I was going to pick up on Charlotte's comment about prevention, and there's a lot about what actually is happening, you know, when you reach a crisis point, but not about prevention. So I work in an industry that's got a high suicide rate, high rate of people being killed, and at the moment they're all a bit depressed because of the changes that have been going on in policies. And I just wondered how many of us had taken the mental health first aiders course, because I did it about 2.5 years ago, and while I was doing it I thought of 3 people that needed help straight away while I was doing the course. And further discussions with my suppliers, I was surprised to find how many of their reps, agents, or whatever you want to call them, had actually been on first aid mental health courses, because they're out there. The first sign they might actually have is when the accounts tell them they haven't been paid for 9 months. Some massive bills of 6 figures in some cases. And so I spent quite a bit of time, well, I always have had, but there's the Farming Community Network, which does completely unfunded work by the public sector. It's all on voluntary sector and volunteers doing the work to be a bit beyond a mental first aider. And I'm just wondering why there's no mention in the report whatsoever of reaching out to these industrial groups, private sector groups, because it seems very much a tick box public sector, people who've, you know, and quite rightly looked after children, people who've leaving, you know, left mental health care and all the rest of it. But there are a whole range of people that do this. On the television about 2 years ago, there was one of my local pubs. The lads were talking about it in the bar, and they realised that there was a whole range of youngsters under 30 who committed suicide in the farming industry, and they did a John O'Groats to Land's End, no top on, top down. It was on television. They raised thousands of pounds, which they promptly gave to these groups. So you can't say that you can't see them. They're there. FCN is at every single agricultural event with a tent, explaining helping, talking to people, advising. Very often, they're advising where the individual gets advice from to help them with their business worries, which are driving their mental health, illness, anxiety, worry, suicide, whatever. And believe me, I work in an industry where we have the means to do it. Very easy. That is another one, a factor that comes into it. Means, as well as the worry and everything else. So I think you need to think about this and reach out to people like Martin Summers, who runs nationally runs FCN, and the other Rabbies and NFU, Cargills, Frontier, tractor dealers, whole host of them who are doing this work. Know where you are and point people in the right direction. If somebody's suicidal, they know who to ring up straight away. And I have to, and because of the work, I do know of somebody who denied he got any sort of mental health illness at all. And when the ambulance was called and the mental health nurse came out, he was sectioned and he's down the road, you know, and will be for 6 months. And but the next bit, none of you followed up on, is the families that he's left behind because he was managing a large dairy herd. Somebody's had to pick that up, and you know the community's going around and helping, but I can't see any of the public sector at all. So there's something missing in all of this about reaching out to these organisations that are there and helping people day in, day out, and no doubt, and they all call it, well, actually it's quite funny, you know, it's like ringing up Richard and you hear the voice and you think, oh, I know who that is. It's the chairman, you know. So there's a small group of people that are really working hard and taking this on of their own accord, and they've been trained and they know when not to go too far. So there's a bit missing, is what I'm saying, Chairman. And the question is, how are you going to fix the gap?
If I could just come in first, and then I might get Chris to speak about some of the stuff around suicide, particularly in suicide prevention. So I think possibly what isn't reflected in here is obviously there is work ongoing with the with a wide range of partners. So, for example, there's a very established Support Staffordshire run a mental health forum, which we attend, we're part of, and that's with quite a big range of voluntary sector and independent sector groups, such as Councillor Atkins discussed, where we've discussed the action plan and sort of areas of where we can continue to work together over the remaining few years of the strategy. So that sort of relationship is there, and we are working with voluntary sector and other groups. I think one of the challenges is the vast amount of organisations, businesses, partners, and that is a real challenge, but that is something we're aware of and we are seeking to address with kind of the action plan, the strategy as the catalyst for having some of those discussions and reaching out more to communities as we progress, because again, as I think some of the members have rightly said, they have some very close experience with people with lived experience who are struggling, people in communities, so that is very important work that we have started and will continue to do. So just to acknowledge that that may not have come across, but that is happening. Chris, I think it's helpful to talk a bit more about the sort of the mental health training side and suicide, please.
Yes, so we're currently looking at funding a package of mental health first aid and other types of supportive mental health training, particularly aimed at small medium enterprises, because that's a particular group that doesn't get it. We're just looking at the evidence to make, because we're just checking the evidence to see whether or not there is evidence that it works. We know that there's evidence certainly that. Certainly evidence that people feel better and feel happy as a result of it, was whether it actually has an impact. So we're just trying to look at that. So we need to sign that off yet. So I'm just being a little bit cagey because we haven't actually quite got there yet. But that's certainly something we are looking at, and it's exactly about what Councillor Atkins, what you were talking about, just trying to fill that gap a little bit, particularly in an area where there isn't a lot of that sort of support. Obviously, the bigger corporate organisations tend to have their own programmes in place. I watch this space, I suppose, is what my comment.
Thank you, Chris. Yeah, watch this space. Work in progress, isn't it? It's something going on. I was interested in what Councillor Atkins has said there, and it's something that at district level, is my cabinet role, that I've just having dialogue with the NFU in terms of also perhaps including Rabbi, who, in terms of where we can, as a district, can signpost. So that's very early days in conversation, but I think it's something that district and boroughs could also do in that respect, as long as they know who they're referring to. So I've got one more speaker on this particular item, and that's Councillor Julia Jessel.
Thank you very much, Chairman, and thank you very much to Jeremy and Jan for this report. As Jan knows, when this report was done, I was Cabinet Member for Health and Care, and we pored over documents, and I was insistent that actually I think I gave you a target of 6 pages for a strategy to make it that it was readily understandable, clear and concise, because I think that's really important, because mental health is such a complex area. If you're not careful, and I think reference has been made to other reports, you can end up going down rabbit holes, and you need to have a clear focus. And it's a bit of a plea for the future. There's one very little point of detail, is actually always include the web link of the original strategy document in your update report, so it's easy for people to refer back to the original document, because I think that's really very important, because that original strategy says the approach is helping people to help themselves in terms of offering good information, minimise medicalisation, which is some of the work that's gone on within primary care in terms of social prescribing and reducing the number of prescriptions for antidepressants, etc. Build and use community capacity, promote independence, co-produce, because I think that's important that there is that input from users of the service, because they're the ones that can tell us actually whether it's getting better or not. Encourage and enable our workforce and embrace technologies. Now, there's obviously a lot of activity gone on, and I went through in some detail that spreadsheet at the end. And if I can refer to item 3.6, which is something Jan knows I was very keen on, I think it's been alluded to other councillors' concern, is having a single point of access. When you're in a crisis, what number, what website do you visit, taking on the point that a lot of young people use the internet, use web links. I looked through 3.6. There's a huge amount of activity, but it doesn't tell me whether we're actually getting there or not. It tells me about extra ambulance services and whatever. I don't wish to be rude, but it's a bit of a plea to the Cabinet member. When we have reports to Scrutiny, we do need to have a clear and concise report that says, are we actually making good progress towards our goal, or are we not? And if not, what are we going to do about it? That report's got a huge amount of words, of which I can hand on heart say, we're halfway through the strategy. I don't honestly know whether we're making the progress we thought we were or we're not. You know, with all strategies, with all projects, you're not going to succeed on everything. You're going to have to rethink some things through. And I didn't find it terribly helpful if I had to turn around to somebody in the street and saying, yeah, we're nearly there with a single point of access, or actually it's getting so complicated, you know, we need to go back to the drawing board, because there were two cohorts of people that we looked at, which was those who weren't previously involved interacting with the mental health system and services. Where could they get self-help information, access to voluntary groups, etc., etc., but also those who had been recipients of mental health services may well have been discharged, but then had another crisis. How do they get back into the system without having to go back to square one? I think that was one of the particular issues that was raised by members of the public. I can't honestly say where you are with progress, and that's just one example. I think there is a danger of using what I would call a working template for officers, and it's different from making clear and concise statements as to where you are in terms of delivering that strategy. And I appreciate there's a lot of work going on, but actually whether it's delivering, and the only way sometimes that you can see whether it's delivering is actually working with those people who co-produced it and saying, well, from your perspective, I'll use Councillor DeVille's terminology, the customer's perspective, whether actually things are getting better. Thank you, Chairman.
Thank you, Councillor Jessel. I take on board your comments and I can understand completely. Sometimes it's hard when you're too close to it and you know it too well. One of the things that I think might help to address this is we attended the Health and Wellbeing Board in December to talk about mental health and mental well-being, including some feedback on the progress of this strategy. And part of that discussion was around how we track outcomes and simplify that. So I think one of the actions that I've taken away, and the director, Richard Harling's also asked me to do, is look at us developing much simpler dashboards, a sort of outcome dashboard for all our strategies. And I think that would address Councillor Jessel's point. So because we've got a lot of metrics in there and some haven't got metrics, but actually I think if we simplified it, you'd be able to see the movement of where we were to where we are. And I think the other piece of work we've started on since the December Health and Wellbeing Board meeting is linking with public health around how we do some focus work around the JSNA around mental health, because we could, the thing for me is we could deliver on the strategy, but the so what? So is mental health and wellbeing better in 2028 than 23? So I think we're looking at how we can use some of the wider JSNA data to track as well to support that. So I think the delivery of an outcomes dashboard is what we're working on now, and I think we'll address some of Councillor Jessel's concerns.
That's very, very helpful, Joan, because I think there is one thing that is important, and the metrics are out there, is minimising medicalisation or over-medicalisation, because GP practices all collect data on prescriptions on certain key drugs, and that information can be readily gleaned to see if actually the social prescribing that all primary care GP practices, I think, are involved in, they've got staffing to do that, whether that is actually having that positive effect of actually getting people more active, more engaged in their local community and less dependent on prescription drugs. Thank you.
Councillor Pert, you indicated.
Thank you, Chair, and thank you for those comments. I just want to pick up a couple of them randomly, not that the others weren't relevant or important. You point about the missing web link, absolutely right. We'll make sure that if members want that, we can circulate that after this meeting, if that's what members want. I think the point about co-production is absolutely critical. Again, that was part of our CQC assessment and some of the feedback that we were giving to CQC. There is always more that we can be doing in terms of co-production, but I also note that there is an ongoing consultation for inpatient mental health services ongoing at this moment in time. And the more we can circulate, that round our own networks, because there's consultations all the time about about various different things. There's one on pharmacy ongoing at this moment in time, and I would just encourage members just to circulate those, because I think it is important to make sure that we've engaged and also got the voices of those people who are used to have been using those services. And I think in terms of the point about the dashboard, I remember that conversation from the Health and Wellbeing Board very clearly, because I think we sometimes miss the outcomes and miss that sort of hard and fast data to demonstrate. I think we probably do need both, because, you know, if we only have data, there'll be some people saying, yeah, but that doesn't feel, you know, like it touches the actual what are we doing about it. And I think we do need both to support each other, and that's the missing gap that we're looking to fill.
Thank you very much for that. I mean, I think there's, you know, you do need the data, you do need the descriptor, but in terms of this scrutiny committee's role and function, we do need to have a clear picture. The spreadsheet that's on the end of this report has got an awful lot of information into it. Some of it you have to say, is this relevant to what you're wanting to achieve? If you're not careful, you put so much information there, you actually cloud what progress you may or may not have taken. And of course, I got picked up on it as well. There is a significant difference between consultation and co-production.
Thank you, Councillor Jessel. So again, we've given an item here, a really good going through. Again, thanking you very much for the presentation and answering the, I don't know what to say, interrogation, but certainly very provoking questions, which is understandable in such an important subject as we're talking about in terms of a good mental health strategy. So the committee's recommended to obviously consider the update, which we've done in delivering this strategy. I'm also mindful that it might be something that could be looked at with a new committee after the elections going forward in 12 months. There's still 2 years running on it. So I would think, as we've already understood, that it's a work in progress as well as a moving document. So I think if we can scope that as a future item for a future committee. Councillor Jess.
So I think what would be very useful for any future committees is to have, obviously you're going to be working on different metrics, but perhaps to have a working group that could actually sit down and talk to people who have interacted with mental health services to see actually whether some of these changes and all this work is actually bringing about the desired result on the ground. Because I think if you're not careful, you can read reports but actually not get a real feel for how the experience is for people who use these services.
Thank you. I think we'll take a note of that, and we'll, as a useful piece of exercise to conduct to get into the depths of it. Yes, Jan.
Excuse me, Chair, if you wouldn't mind me just coming back on that very good point around particularly links to co-production, which is an area we recognise we want to develop, recognising that consultation engagement is not the same thing. So the work we're just starting discussion is around how we link in with people lived experience to talk about the strategy and the action plan. And that will be linking in obviously with Children's Services ICB. There is work already going on, as Councillor Pertz mentioned, around inpatient consultation, which we are kind of linking in to share the learning from that. But particularly we've spoken to the Support Staffordshire Mental Health Forum with voluntary sector groups who've got a lot of people lived experience that they support. So that is work planned for this coming year.
Thanks for that very useful information. I think that's certainly going forward for a committee to work with, and so welcome that. So committee, are you content that we've received that, noted, and we'll discuss about putting that on a future work programme just to keep ourselves addressed. So thank you for that. So thank you all there for Jan and Nikki and Becky and Chris. You've all done very well, and Councillor Pertz as well. So thank you all very much. So we'll now move on then to agenda item 6, and that is the District and Borough Health Scrutiny activity. You have the report before you. I'm not necessarily going to go round the table unless there's a borough representative, district representative wishes to update the committee, but obviously information is there, but happy to receive any comments from those representing. Councillor Norman.
Yes, thank you. I'll read this out, actually, and then I'll pass it on to Zach, so you can use it as an aid memoir if you like. So, with regard to the task group, the Health Scrutiny Task Group was set up at Lichfield District. They actually met on the 27th of February. Now, this is the odd part. The Councillor Janice Sylvester Hall was apparently a witness, going against the code between the district and the county, but I'll inform members about that at another time. The two items being discussed were the Samuel Johnson Birthing Unit and the Birthwood Health and Wellbeing Centre, and this committee has had reports on the birthing unit that was closed at the beginning of the COVID epidemic, and the proposal has been that it should not be reopened. I have asked the ICB what the reason is for the delay in the mandatory assurance process, which follows that, and the NHSE Midlands that has been that is to be undertaken following this process, and I'm told that they hope to have a response soon. The permanent Birmingham Health and Wellbeing Centre has now been delayed for over a decade. The temporary modular building for a walk-in centre was granted planning permission for 5 years in December 2008. And almost exactly 2 years ago, Chris Bird, the Chief Transformation Officer of the ICB, confirmed to the District Overview and Scrutiny Committee that it had worked with colleagues at Staffordshire County Council and had opened Greenwood House Health Centre and the new, quote, Burntwood North Centre, unquote, at Cherry Close would be open and operational from 2025. As of this morning, a planning application has not even been received. Thank you.
Thank you for the update, and on your behalf, I will discuss that with the relevant people. But I do understand where you're coming from as a Lichfield district. Yeah, I've got it. It's noted. Anybody on the...
Chairman, on the
Yes,
district reports, there was one East Staffordshire. We received a report. I'm just wondering if it was the last meeting or the meeting before, actually, because we were very close together, about the one of the GP practices that had just walked away and what was being put in place to cover it. So there's a new practice taking it on and going forward. So there's a lot of reassurance about that from the ICB. So just a general report that they are being informed of things that are happening, changes in primary care, and they accepted it.
Anybody else? Councillor Prestwood? No?
Just a couple of items I wanted to mention was that I sent a letter out to Mr Peter Axon from the Wolverhampton Health Trust, inviting him to our scrutiny committee, but I haven't received anything back yet, so I will send another invite out. Mr Hewitt might want to speak.
Councillor?
Yeah, carry on.
Councillor Hewitt?
Do you want to finish off?
Yes, I'll finish off. And also I've sent an invite out to the Adult Road Safety Committee in Stafford, asking for them to come and give us a talk on adult road safety. We also had a Living Well event at Cannock Leisure Centre, and it's involved with Household Support Fund, and we're inviting someone from there to speak to us about that. Okay, and just one more thing that I'll just give you Phil this one. That this is just opened in Cannock. It's an adult centre, Coronation Court in Cannock, and that's for adults with complex needs. That's filling up at the moment, but there's 30, I think there's 31 or 32 rooms, but it's for people with complex needs, and that's just opening in Cannock, so that's good news. Okay, thank you.
Councillor Hewitt.
Yeah, just I think it's important to support Councillor Presswood on this as far as the MRU unit is Cannock. Or the lack of MRU unit in Cannock. It was, as the committee, those have been around a while, it was closed as COVID started, and quite rightly, nobody argued with that, with a promise that it would return, and numerous promises along the way that it would return, and it's been brought, prior to you being chairman, it's been brought to this committee numerous times, and with terrific help from the officers, both from Cannock and from the County Council, particularly Zach. We continue to bring this. Now they appear to be ignoring us, so that I asked the chairman of the Scrutiny Committee in Cannock to write. It was in agreed. Councillor Presswood has been a great ally on this, and now it appears that they're not even replying to anything. So certainly I know that Charlotte Atkins has had the same sort of issues, and they're not going to ignore us, and we're going to keep going on this. All right. I'm done. I'm quite passionate about this, so I wanted to make a point. Thank you.
Thank you, Councillor Hewitt, and I think I share the concerns that you're expressing, as I shared with Councillor Atkins with the Staffordshire Moorlands. So I do have regular meetings with the ICB and Tracy Shewan. It'll something I will raise with them on your behalf, if that's acceptable. Okay, I'll undertake to do that. Okay, if we conclude that, then we move on to the item 7, which is the our committee work programme, 24-25 update. We're obviously getting very to the completion of our work programme. As you will see, we've no items going through for an April meeting. I think we're all aware that obviously with the PERDA, etc. for the county elections, we will possibly, unless something comes up very shortly that we feel that we've got to speak and present, I would say that's where we're at, we'll have concluded. There is a nice list there where we have gone along that would be recommendations for whoever is in this chair and whoever is round the table, because we can't be presumptuous. Hopefully Zach will coordinate that as and when. But if there are any other items, the one item I did want to just speak on, just so we've got a bit of guidance going forward, and I know that this will be news for Councillor Peters. Prevention of obesity and diabetes. I think for a report, because that was an April item, and it's now obviously to go into the next council. I think what we would want, if it's possible that members could actually, we would like to scope exactly on the obesity and diabetes. Are we referring to, in terms of, say, diabetes, are we referring type 1, type 2, overall diabetes? Are we wanting to look and concentrate on diabetes in children with type 2, or obviously adult, or effectively the whole, because it's a big subject. And I don't want us getting tied into missing a trick that what the committee wants. So obviously that's an important bit. Councillor Peters.
Yes, thank you, Chair. That'd be very welcome, I think. I would recommend that we talk about type 2 diabetes related to obesity in young people and see if it moves on to older people, because that's where the problem starts. Young people, it's associated with lifestyle choices. And the point that was made earlier about getting carers and family members more involved. Are the NHS informing? Are there good, rock-solid communication strategies around diabetes care, type 2s, obesity? That's the thing, it's obesity related. And I do hope that the meeting won't slip into, well, we need Tesco and Morrison's here to say why you're selling these products without labelling them more clearly. Because that's something else that's cropping up in diabetic support groups.
Thank you for that. I think probably the aim would be on ensuring we've got a clinical answer in terms of and recommendations that we can investigate. Councillor Janice Sylvester-Hall.
Yeah, Chair, my point is on the women's health side, so can I just check that you've finished on the other one before I carry on?
No. Councillor Hewitt.
Thank you, and excuse me. Sorry, after a discussion with Councillor Presswood there, I don't understand what the councillor said when he talked about bringing in Tesco and Sainsbury's. I just didn't understand your point, Councillor Peters. So you can expand on that. Thank you.
There's a lobby from people saying that major supermarkets are not doing enough to identify the calorific content regarding carbohydrates in a lot of the products they sell that will assist diabetics to make the right choices on what they buy off the shelf.
Good point. Thank you very much for clarifying that.
So obviously that's what on the obesity, diabetes is obviously, if you've got any ideas, send them to me and Zach, and we'll develop something from ensuring those report writers we're getting the correct report for us to investigate in. So Councillor Sylvester-Hall.
Yeah, just very quickly. I'm also acutely aware of the fact that we're coming to the electoral cycle, and the Women's Health Group, having had the report published at the tail end of last year, I'm pleased to say has received approaches from a pharmaceutical company in regards to some support that they may be able to deliver for the recommendations in the report specifically that was produced by the Women's Health Strategy Working Group here. I think the important part now is to facilitate what is in the world of possible with regards to those, and whether it's me this side of the election or somebody else after, there are some genuine offers of support that I think are definitely worth exploring, and I'll be trying to continue those in the run-up to the election, and certainly as far as what I can do to facilitate it afterwards. But again, a big thank you for those who fed into the report. That offer wouldn't have been given to us if we hadn't have done that work in the first place. Thank you.
Thank you very much, Councillor Sylvester-Hall, and obviously thank you for that piece of work, because it really has attracted. You know, this is media coverage, obviously what you're telling us there, pharmaceutical coverage, so it's actually has highlighted something that is extremely important. And I know, speaking on behalf of us men, I think we were quite surprised at the extent of that, what you have to go through, and that lack of understanding, and obviously bringing that forward, that can only be good news. So I do appreciate that. So if there aren't any other items, and then in the possibility of no meeting in April, May I, as your chair, thank you all for your contributions to this committee, because without you, it wouldn't work. So I'm more than grateful for that. I think we do give our reports received and so forth a good questioning, etc., to get the, you know, not to say things are wrong, but to make sure things are being conducted right and in a proper manner. So I thank you all for that. So I wish you all very well, and thank you for your attendance, and I'll close the meeting at 12:45. Thank you.